For the first time in 3 years, South Korea fully returns to pre-pandemic normalcy. As of today, there's no more mandatory self-quarantine for those who have COVID-19. And the mask mandate is also lifted in most medical facilities. This as the country heads into the endemic phase. Our Choi Soo-hyung has our top story.
From Thursday, June 1st, South Korea's national crisis level for COVID-19 will be downgraded from serious to alert. After a battle lasting 3 years and 4 months, the lasting remaining antivirus measures are no longer required. First, there will be no mandatory self-isolation for confirmed cases of COVID-19. People who catch COVID-19 are still recommended to self-isolate for 5 days, but it is no longer mandatory. The indoor mask mandates at clinics, doctors' offices and pharmacies will be lifted, except for high-risk facilities such as senior care centers and hospitals.
I feel much more comfortable. We didn't have to wear a mask except in clinics or pharmacies, but there was still the hassle of carrying a mask. It is much better because it's all lifted finally.
Incoming travelers will no longer be recommended to take a PCR test, and the testing centers for these travelers will be closed. The number of confirmed cases will now be reported weekly rather than daily. There are some concerns about easing regulations as COVID-19 has not been completely gone. However, the health authorities have determined that the situation in South Korea continues to improve, is being managed stably, and that the medical and response capacities are sufficient. Therefore, they announced the intention to transition from an emergency system to a daily management system.
The health authorities will follow a roadmap to adjust the crisis stage until COVID-19 becomes endemic, like influenza, and can be continuously managed, fulfilling their duty to protect people's health.
However, they stated that if a highly serious mutation occurs, they could consider raising the crisis alert level again. Choi Soo-hyung, Arirang News.